Hi everyone, I'm Dr. Danielle Lockwood, physician at Terrain Wellness in Portland, Oregon. Today we're going to talk about prolotherapy and joint pain. So first of all, what is prolotherapy? So prolotherapy stands for proliferative therapy, and it rebuilds cartilage, increases white blood cells, so it's really good and stimulating for the immune system, and it actually stimulates the immune process, which leads to long-term improvement in pain and function in joints. So there's quite a few studies, but one study by the United States National Institute of Health said that prolo or prolotherapy resulted in sustained improvement of the following things: pain, function, and stiffness in joints. So why don't joints heal? So like we injure our joints, and why aren't they healing like the rest of our body does? Well, joints are avascular. That means that there's not very much blood flow going to the joints. And the other problem is people think that inflammation is all bad. And yes, when it comes to allergies and autoimmune and cardiovascular disease, we definitely want to lower overall inflammation. But when we're talking about healing joints and healing injuries in the body, we need to heal injuries, so we need inflammation. So what is a conventional treatment for an injury to, say, your knee or your hip or some of these large joints like elbows? NSAIDs. So NSAID stands for non-steroidal anti-inflammatory. These are going to be things like ibuprofen, Advil, even Tylenol will to a certain extent fall into that category as a pain reliever. And studies have linked NSAIDs to actually damaging cartilage. So that sort of, pun intended, knee-jerk reaction to go get something to help with the pain can actually cause damage to that cartilage. So what's another common treatment when we get an injury to a knee or to a joint? Cortisone shots. So cortisone, they'll put various things within that shot, something called Cartilage or different kinds of steroids that will go into the shot. Studies show that repeated steroid injections over 2 years brought no long-term improvement in reducing pain whatsoever. And not only that, I'm going to show you a couple of before and after images of the joint space destruction in hips. So as you can see from these images, there was a nice little space in between that round little bone and the socket that it goes into. And right after, or at least a couple months after cortisone was injected, that space went away, meaning that fresh cartilage and all that nice healthy tissue was eaten away by that cortisone injection. No good. And studies have actually linked cortisone injections to reducing bone density, so putting you at a higher risk for osteoporosis or breaking of bones, damaged and degenerated cartilage, and get this, a 3-fold increase in total knee replacement surgeries. So that's right. Cortisone actually puts you at more of a risk for having to have surgery, which is crazy. So how do we do prolotherapy? So first of all, as my mentor told me, the needle counts. The actual needle itself will go into some of these joint spaces where the ligament attaches, and it starts to inject a fluid. Usually we use a combination of anesthesia and just simple dextrose, a sterile dextrose, which is a sugar that acts as an irritant to the zone. So not only the breakage of the collagen cross-linking will go in here to help rupture and stimulate that immune system, but then the solution itself then stimulates and calms the nerves down. And so people will notice that they'll get pain relief within 24 hours or even right away, because the anesthesia will go in and it feels so nice and so soothing. And dextrose and local anesthesia are some of the things we can use. Other people might use things like ozone, or they might do something called PRP, which we can talk about in another video. It's very good at regenerating torn tissues and pain. So what is it great for? Prolotherapy is great for knee pain, meniscus tears, muscle pain, and trigger points. It's really good for things like whiplash, like if you've had a car accident and the muscles are so stiff and so painful, it works fantastic for that. Sprains and strains, acute injury pain like that car accident, rotator cuff tears, or TMJ, which is the joint in the jaw, headaches, chronic headaches. It's great for chronic headaches, especially when it's related to tension in the muscles or the jaw. Lax ligaments and unstable joints, like if you're constantly pulling out your hip or pulling out those joints, it's really good to get the ligament attachment strong. Low back pain, and it's great for scars, especially if you have a scar over an area of your body that's really painful. It can be super, super helpful for that. What prolotherapy is not great for? Autoimmune pain, fibromyalgia, chronic myofascial pain. When you have a severe disc herniation where it's completely slipped out, probably going to need to have orthopedic surgery for that one. Or if you have a complete tear of, say, your rotator cuff or the ligaments in your knee where it's gone all the way through. Pain from cancer. Prolotherapy doesn't necessarily help from this, and it can actually make it worse because it overstimulates your immune system, and that's not really what you want to do in these cases. But otherwise, it's great for a lot of things, and we use it on many things like osteoarthritis. It's great, and there's so many studies on it. We love prolotherapy. It's something that we practice here. I've been highly trained in it, and so we love to help take people out of pain naturally with prolotherapy. Thanks for tuning in. We'll see you next time.